In Europe, we are commercializing three products for the moment, and these three products are exactly in the area we are interested in: high unmet medical need, innovative, and meeting patients' needs and carers' needs. ViroPharma is committed to bring new products to unmet medical need areas, and epilepsy is one of these areas where new products have not been brought forward for quite a while in acute seizure management. We have brought a new therapy to this area just recently, and so we're very excited today to bring this new therapy to the patient.
NICE updated the guidelines for the diagnosis and management of epilepsy in 2012. This incorporated information on new drugs being available to healthcare professionals and also on information how to manage emergency care of patients with epilepsy. Prolonged seizures are seizures lasting longer than 5 minutes. It is important to treat these seizures as quickly as possible after this time point to avoid any detrimental damage to the brain, especially through lack of oxygen. The guidelines also state that emergency care should be given to children, young adults and adults if they are continuing having prolonged seizure activity. ViroPharma is committed for patients, carers and healthcare professionals to have up-to-date information on new drugs being available. To this end, ViroPharma provide training and education and resources for healthcare professionals to disseminate to carers and patients to ensure that they use our drugs appropriately and with confidence.
I feel that epilepsy care has progressed actually a lot over the last 25 years or so. Epilepsy's had its fair share of stigma, neglect. It's never been that sort of in the media top-notch sort of condition. We've progressed because we have now these trained specialists. We have nice guidelines about epilepsy, and we have better diagnostics for epilepsy, so we can get patients in to see the right specialist, to have the right test, and hopefully get people diagnosed and receiving treatment a lot quicker than we used to. Historically, for emergency seizures, we've used in the UK rectal diazepam, and I understand that's still used in Europe today. Although more recently in the UK, we've been using buccal midazolam, which is an alternative. And now I understand that since the 2012 NICE guidelines, they've now recommended buccal midazolam as a first-line treatment for emergency seizures. The most important things for using rescue medication in the community, or buccal midazolam in the community, is that the healthcare professionals, the prescribers, feel confident enough to prescribe the medication. And I think it's imperative that they get educated and trained in how to use the medication, but more importantly, why? Because we do know that emergency medications are life-threatening. The other thing is that the patients themselves and the carers understand how to effectively administer the drug, the dosage of the drug, so that they also have confidence in using it in the community. Treating prolonged seizures is really important because these prolonged seizures carry a risk of fatality. Therefore, making sure that the patient is prescribed a rescue medication, for example buccal midazolam, reduces the risk of this essentially fatality. It's also important to educate the clinicians who prescribe the medication, because historically they've only been aware of the rectal diazepam, and then now we're providing something new. It's not necessarily new, but to GPs it's a new product. So providing them with training about the product, providing them with the background information about epilepsy and prolonged seizures and the danger that it holds is really important before actually prescribing the patient the drug. Now, if the patient is prescribed buccal midazolam, it's important that someone, whether it's the clinician or a nurse, trains the patient, educates the patient about the drug, why we're using it and why it's important to use it.
At ViroPharma, we really believe in making a difference for patients and patients' lives. And as part of that, it's also their families and making their lives easier, and also the people that look after them, so the doctors and nurses that are actually caring for those patients. I think it's really important for doctors and nurses and carers to have full confidence in buccal-midazolam and in the product that they're using to treat seizures. They understand the seriousness of the condition, and it becomes vital then to make sure that they're actually administering the drug properly, and in turn so that they can pass that message on to families and other people that are caring for children with seizures.